there, welcome back to our YouTube channel. Thanks for watching. Please remember to like the videos here on YouTube, subscribe to the channel, and also click the notifications so that you get notified when the next video comes out. You can also check out the playlist for other videos to do with cosmetic surgery. So today I'm going to be speaking to a doctor about the tummy tuck procedure. Hi there, thanks for joining me today. Please introduce yourself and just tell me a little bit about where you practice.
Hi, thank you very much for having me here. It's really an honor to be here sharing my practice information with you. And my name is Dr. Opoku-Agyeman. My practice, I'm a plastic and reconstructive surgeon. I am based in Pennsylvania, in the city of Philadelphia. I have two practices, one in the inner city, Philadelphia, and I have another practice in the suburbs of Pennsylvania, where I see my patients from all over the continent and from across the globe.
Brilliant. Okay. So we're going to be talking about the tummy tuck procedure. So first of all, if I was thinking about having this procedure done, what would make somebody an ideal candidate, and what would make somebody, make you say, no, this is not for you?
Okay. So the tummy tuck procedure is basically, the procedure is indicated for individuals or patients who have a lot of skin on the abdominal wall that they would like to get rid of. Sometimes patients have undergone weight loss surgery, or sometimes just due to age, gravity has set in and a lot of the abdominal walls skin become very lax. And so most of the times we have patients that have had multiple pregnancies or just a single pregnancy, where the muscles of the abdominal wall have become so lax that the stomach or the abdomen really pouches out. And so the tummy tuck is for those patients that really want to contour the abdominal wall to give them a flatter, leaner look. The patients that are not really good candidates are patients that really have a lot of subcutaneous tissue, or what we call fat or lipodystrophy of the abdomen. And as I tell my patients, tummy tuck is not a substitute for weight loss surgery. And so it's mostly for people with predominant skin rather than fat. If you have a lot of fat on your tummy, the tummy tuck is not really a good procedure for you. You may consider weight loss surgery, or probably a liposuction surgery.
Okay. So just like on that as well, what would make someone better just to have the mini tummy tuck?
So yeah, that's a very good question. That's a question we get asked quite often. So the difference between a full tummy tuck and a mini tummy tuck is in a mini tummy tuck, usually we are just resecting the lower part of your abdomen, just below the belly button or the umbilicus. And it's usually indicated for people, if you take your belly button as the center point of your abdomen, if you have a lot of loose skin just below your belly button, then you can do a mini tummy tuck to tighten that aspect of it. But if you have a lot of loose skin above your belly button, then a mini tummy tuck is not a good option for you. Then you need a full tummy tuck. So that's the difference.
Yeah. Okay. And when it comes to like the muscle repair, how can somebody tell if they need that before, or is that something only you would be able to tell them?
Yeah, it's usually people that need a muscle repair. Usually, it's in evaluation by the plastic surgeon to be able to determine. So when I see them for consultation, I ask them to suck in, take a deep breath in, see how tight their muscle is, have them relax, and see how much excursion of the muscle there is. And just by manual palpation of the abdomen, I can tell if the abdominal wall or the muscles are very weak, or you have what we call rectus diastasis, where the muscles are not together, they are gapped. And so those are usually, determined during the consultation and the physical examination.
That's brilliant. And also, a lot of people, when they have this procedure done, they have lipo done at the same time. Is that something you do as standard, or is that something that you do as an extra?
That is something I do. My standard approach is that anybody, because I just don't, in the olden days, the dogma was that abdominoplasty was just abdominoplasty. You go in, you take off a lot of skin, and that's it, and it's done. Oh, I don't have any belly anymore. But in this day and age, patients are coming to us not just to take the skin. Patients are coming to us for us to contour the body. So when we go in, we are trying to look at adjuncts, things that we can add to the abdominoplasty or the tummy tuck to be able to give someone a smaller waist. So my 3 things for tummy tuck is, a natural looking belly button, low hidden scar, and a nice cinched or contoured waist. And so in my practice, standard, everybody gets liposuction of your flanks or your sides to be able to give you that narrow waist look and hourglass look. However, some surgeons will sometimes also do liposuction of the abdomen. However, you just have to be careful when you do tummy tuck combined with liposuction of the abdomen, because if you do an excessive amount of liposuction, you may devascularize the abdomen, and people may end up with, belly button necrosis, abdominal wall necrosis, and they can open up their wounds because you can disrupt a lot of the blood supply to the abdominal wall doing the liposuction.
Okay. Another thing I wanted to know is obviously some people as well are having drains and some people are not having drains. What is, like, how do you determine kind of like who can have that procedure done, or is it just that some doctors are doing it without drains? And is there any benefits of having drains or no drains?
Yeah, that's a very an excellent question. We get asked that almost every day. And so, as you had mentioned, the difference between the two procedures is sometimes we leave drains, either one or two drains. Some people even leave three drains. Others don't do the drainless procedure. The drainless procedure simply, after the tummy tuck, instead of leaving the drains, we don't leave drains. We put stitches, internal stitches, what we call progressive tension sutures inside to hold the abdominal skin down on the abdominal wall, so that you kind of close up that space between the skin and the muscle. And some surgeons have been trained to do it. Some have never done it. And so some surgeons are very traditional. That's all they've done. They leave drains and they won't have it any other way. However, I'll tell you that a recent study published by that was published in the Journal of Plastic and Reconstructive Surgery showed that people that have had a drainage procedure, the results were really good. The rate of accumulating fluid or seroma was really, really low, and sometimes even in a par to if you left drain. So both procedures are very good. The one disadvantage of leaving a drain is that the drain is a foreign material that comes outside of your body, so it can serve as a conduit between the external environment, which is not sterile, and inside the abdomen, which is sterile. So if you leave the drains in, sometimes people can have infections from the drain if they don't take proper care of the drains. And so those are the downside to it. And then if you have patients that are from outside your state, like my state, I have people from all over, and I leave drains. Usually we take the drains in from 7 to 10 days. So it means sometimes they have to stay in town until you take the drain out before they can fly out. Or if they fly out, they cannot stay. Then they have to find someone else who is going to take the drain out for them. And so it's quite a little bit messy that way.
Yeah. Would you say that having to me it sounds like if you was to have drainless, you may have less swelling. Would that be true, or is everybody just going to swell anyway?
Oh, everybody's going to swell anyway, exactly. Because the swelling is a natural part of the healing process, that what we call the inflammatory part of the healing process. Edema, swelling is part of it, but you just don't want that. And then when you create the space, your body's going to generate a lot of fluid. You want a way where all the fluid can come out. And so they are both. The results have been shown to be about the same. It just depends on the surgeon's preference, the patient preference.
For that, okay. So a lot of something a lot of people are always talking about as well is the scar. So how do you determine like where the scar is going to go? A lot of people, they obviously like their scar to be very low down, and is that something to do with each individual person's body shape, or is that like something that a surgeon would be more kind of be able to do that, make a low scar, or is that just down to the body shape of the person?
Yeah, it's a bit of both. I think each surgeon should always strive, to place the scars low and hidden, because it's aesthetic surgery, and people don't want the scar on full display if they can afford it. And at the same time, you've had patients where they want a tummy tuck, and sometimes they don't have a lot of skin to pull down to to be able to put the scar very low. So sometimes we bring the scar up a little bit. And so if your skin is very tight, you don't have a lot of excess tissue, sometimes we put the scar a little bit high, or we can put it low, but you're gonna end up having another straight scar in the middle of your belly. So some people don't like that. So, but I think that most people that I have done have enough skin, if you do it right, that you can almost always place the scar very, very low, except in cases where we have to do a revision because someone had a tummy tuck. They didn't like their results from somewhere. We want us to revise it. They've already taken a lot of the skin, and now we have to try to redo everything. Those are very challenging.
Yeah. So in your practice, kind of like what happens on the day when somebody goes in? Do you give them a compression garment? Would they need to get their own? Do they stay in a hospital for a few days? Or do they go home straight away? What can someone expect from going to have a procedure done with you?
So my if I do a straight tummy tuck, all my patients for my tummy tuck go home the same day. In terms of pre-op, I do a very extensive pre-op visit with my patients where we go over their expectations, my expectations, and the post-operative care, which is the most important aspect of surgery. You know, how you take care of yourself after, what to eat, what not to eat, how to drink, and everything. And so as part of that, we usually provide the patient with compression. Well, I use an abdominal binder whilst they have the drains in. So the abdominal binder they put around them until the drains come out. And when the drain comes out, then they're gonna wear the compression garment. The compression garments, we have it in our office as part of, sometimes we include that as part of our package. So when they come to me for their post-op visit, once I take the drain out, we size them in my office for the compression garment so that they are not buying multiple, trying to figure out what's going to work for them. You're in the office, we have different sizes, different shape. We put it on, it fits you, and then you go home with that. And so that's what we do. And some patients want to go and buy their own, and we don't force them to buy our products. We tell them just make sure they get something that fits. That's not too tight, that's not too loose. You want it nice and snug. Yeah.
Good. And also, when you have the procedure done, whether it's lipo or just the tummy tuck, so without lipo, what happens with the weight gain? Can you gain back weight in that area? Because I hear quite a lot that you can't gain back weight at all. But what if you was to just over the years put on a lot of weight? Is it possible to gain back weight there? And if not, where does any extra weight go?
Yeah. That's a very good question. There's a lot of misconceptions out there, and just my experience alone, I know that after tummy tuck liposuction, yes, you can certainly gain weight back there. I have seen patients that had liposuction done, they took a lot out, and they show me their before pictures, and they look amazing. And then they come back, a couple of years later, sometimes 3-4 years, and they put on weight there, and we have to go back and re-lipo. So I know it's possible. The what confuses people is that when each of us is born, let's say you take your tummy, the front part of your tummy, you are born with the same number of fat or cells or adipocytes, so the same number. So you can never increase the number, but you can decrease the number. So when you are doing liposuction, all that you're taking is taking out all the adipocytes, decreasing the number of fat cells that you have or the tissue. However, if you gain, when you do liposuction, you can't take every single one of the fat cells out of your body. It's impossible, right? Okay. So when you gain weight, you're not going to increase the number of cells you have because it's constant. But those remaining fat cells can get bigger and swell and swell and swell. So you can gain weight. And so I've asked people that maybe can also, it's hard to put the weight where you did a liposuction because you don't have a lot of fat cells to take up all the extra weight. So they may go, sometimes you may have weight gain in your back, your arms, they'll find somewhere to go. And so it's just a matter of where you decide to go. Exactly.
God, okay. You have to be careful.
So I tell people it's imperative that people understand that, as I said, once again, committing to cosmetic surgery means that you love your body, you want to be in the best shape, you want to look good for yourself, and maybe for other reasons. It's an investment. And sometimes surgery is always, it's not if you think surgery is the easy way out, then maybe it's not right for you. You have to make a conscious effort to love yourself and to be able to say, look, I'm going to commit my money, my time, and resources to this. And then I'm going to take care of the new body that has been given to me. So healthy eating, exercise, and just starting all over, it's going to serve you right.
Yeah. Last question for you. So just tell me about what kind, obviously nothing is plain sailing here when you do this, it's major surgery. What kind of complications could people have?
Yeah, so a tummy tuck, for the tummy tuck, the complications, is a lot of them, but most of them are very rare. Number one, the most feared complication that every patient asks me is like, I just want to wake up and go to see my family, of course it's surgery. And I tell them, well, our aim is that, you are going to get through the surgery and go back to your family. And so that largely depends on your health history. So we don't do surgery on people. Everybody is evaluated individually, irrespective of your height, your weight, and everything. We look at your medical records, everything. We examine you, make sure that your body can undergo the procedure and that anesthesia. And then dying from tummy tuck is very, very rare, unless sometimes it does happen because people have unusual reactions under anesthesia, and it's hard to tell, but the complication rates are very low. The other things are wound infections. A lot of people, some people will open up their wounds, they will spit out stitches, the body doesn't react to the stitches, or the body doesn't like the stitches. It's very, very common. Those are really minor. If your surgeon is attentive and you are attentive, you're able to detect these things early and fix them without any complications. Things like black clots in your legs, what we call deep vein thrombosis, are also something that we watch out for. Usually after tummy tuck, people are sore, they don't want to move around, and they lie down, and that can predispose you to developing black clots. So we expect all our patients to get up and start walking, the day of surgery, so moving your legs around. And then also pain control. People don't move because of pain. So now for me, in my practice, I do a lot of good pain. I do what we call the transversus abdominis plane block, or the tap block, where I go into the nerves of the abdominal wall. I know where they are. I put a nice needle whilst you're sleeping in there, and I block your whole abdominal wall.
And you do that as that's a standard, yeah?
It's standard.
You do that with everyone?
Yes, I do that with everyone now. And then we block everything, and then hopefully, and that lasts good 72 hours of pain control together with other pain medicines. And so that's another thing. And other things like wound infection, which is very rare, but it does happen. And the belly button or the umbilicus can sometimes die, especially patients that have had multiple abdominal surgeries like hernia, umbilical hernia surgeries, and things like that. So those are the major ones, or the most common ones that we see.
That's brilliant. I forgot to ask you, sorry, about, if you don't mind me asking, about price. What could somebody expect to pay if they had surgery with you for just a tummy tuck and muscle repair, say? Okay,
so people are sometimes pleasantly surprised. That's what I find when because it's very. I had someone you come to you like, oh, this is the price. Like, wow, I saw on someone's website and the deals were very, very cheap. What are we talking about here? So people have to understand that when it comes to cosmetic surgery, there are three prices that you're looking at, right? You are looking at the surgeon fees. So that's what the surgeon charges for his services to you, or her services to you. And then you have to look at the hospital or the surgery center. They charge a separate fee. And the doctor who is going to put you to the anesthesiologist or the anesthesia group also charge a fee. So you have three fees, and then other things like products, compression garments, all that stuff. So if you combine those, for me, when I give a quote, I don't give a quote just for my fee. It's a quote for all your services. And so depending on your body habits, of course, I specialize in, I have another specialty in high BMI plastic surgery. So I do a lot of, people that are on the heavier side that want body contouring. So my prices can range anywhere from, depending on how big you are and how much work I have to put in. So tummy tuck, the total price can range from anywhere from 9,650 to close to about 20,000. So it's a wide range. So it depends on what, and all the add-ons. It depends. So if you want a lipo of your back on top of it and all that stuff.
Yeah, of course. That's brilliant. Well, I'm going to put all your contact details, website address in the comments below of the video so that anyone can get in contact with you if they want to after watching the video. Okay. Thank you so much. I'll speak to you later.
Okay. Have a nice day.
Bye-bye.